That would be great.
And good morning. We are recording the 9:30 call this morning. So it's great to see folks. Folks are just coming in after a 3-day weekend. We have a bit of a different schedule this week for the 9:30 call. So we're here today and tomorrow, and then we won't have a call on Thursday, but then we will be back full strength on Monday, February 26th. So we'll look forward to that and to this week. And so as we get started, I know there's a team from Project Bread is here, and we're going to hear from Laron, but if there's any other team members that want to say good morning. This week, we also have the 9:30 call at night in Spanish on Wednesday night. So we can also put those link in the chat. It was included in the email that went out last week for the call. So we hope folks will join. Our advocacy network participants, Paula and Harold, who everybody met on the 9:30 call, are working with NARI, and we're really excited for that. Great. So Laron, I guess we'll start with you. And if you could just tell us a little bit about you and how you came to be in your current role. And then we're really excited to hear the update from Project Bread.
Sure. I'm thrilled to be here. I recognize a few people in the participant list, but a lot of you are new to me, which I think is super exciting. I'm Liron. I'm the Assistant Director of Policy at Project Bread. I've been at Project Bread just over 8 years. During my time, I started off on our Walk for Hunger team, just a temporary employee, and then I moved into our child nutrition team. So we'll get into that in a little bit more in a moment, but that's a team that works primarily on school meals, school breakfast, more so than lunch, and summer meals. So different than CACFP, but definitely some overlap in some of the regulations and rules there. So that's where I got started, really with the work at Project Bread, and then moved into our policy team about 6 or so years ago. There was a little bit of overlap, but around that time, and been part of our policy team, and just really love doing that work. And really appreciate the work that all of you do. I have a 4-year-old, so on a very visceral, personal level, just all the childcare out there. The program he goes to is not a CACFP program, but just I know how hard it is to just feed one kid. So feeding a lot of kids at that age is just, I'm sure, much more challenging and interesting and exciting in all its different ways. I think that's probably, I'm happy to answer anything else about myself, but I could get right into the slides, and if anybody has questions about any of you ever work Project Bread does, or anything else that I just mentioned, happy to go into it.
Great. So I think, this is part of our highlighting the early childhood agenda work. So we know that when we did the work in the fall of 2023, this issue came up. We watched and cheered on Project Bread as you worked so hard to get free school meals in Massachusetts. And then, as we learned more about kind of what your next steps were, we were so excited to see how this work fits so beautifully with the work of the early childhood agenda. So we know that's you're one of our existing coalitions that we're working with on the early childhood agenda. That's why we're recording this call. So the update that you'll hear today, as well as kind of next steps that we're excited about listening sessions, we have been sharing that information. So I think that's it. I think we just want to, once again, share our gratitude for all the work that you and the team at Project Bread have been doing. Jen Leverman was one of our first 9:30 call guests back in 2020. So we're so glad to be doing this work together with you.
Yeah, and that gratitude right back to strategies and a number of other groups on this call. That success with School Meals for All for the K through 12 programs, and some early childhood programs that are part of the National School Lunch Program. That was just such a great, amazing coalition, and a lot of people have been asking what's next, and we're trying to figure that out so we can answer that question better. But really hoping that everybody who was involved in that, and hopefully many more of you who maybe we're working on other things, other important things, will join us on whatever is next, because I think that was just such great work that we did together.
One thing I just wanted to highlight is I was talking to an elected official who was such a huge supporter of free school meals and also of early ed, and didn't realize that early ed was not part of free school meals. So, I think it's also worth a reminder that sometimes when we all kind of talk our inside policy speak and know what we're talking about, how we talk about it, on the outside. So I think this is even more exciting that you are thinking about these next steps. So I'll turn things over to you and we'll look forward.
Great. So let me get the slides up. I'll get my notes up there. There we go. Yeah, so I already introduced myself. Anybody else who joined later, I'm Liron Mintz. I'm the Assistant Director of Policy at Project Bread. And I'm going to share a little bit about the Child and Adult Care Food Program and then get into the listening sessions that we're doing with EC and strategies. But I'll preface that Project Bread, and I'll talk more about this in a moment, we have a lot of experience with the federal nutrition programs. But CACFP is an area that we're still learning a lot about. So I'm really thrilled to be here to share a little bit, but also looking forward to learning from all of you. There's a lot for us to know about. So I don't want to present myself as a deep expert on CACFP because that wouldn't be honest. But we definitely have experience in a number of the other programs. So we will share on the last slide about those listening sessions. We're working with the Department of Elementary and Education and Care and strategies to hold those listening sessions. So really learn more about what's working and what's not working. From a Project Bread perspective, would really be interested in what policy changes need to happen around CACFP on both the state and federal level. And I'm sure that everyone is interested in what programmatic things we can do to support. So I'm going to go through a little bit about the basics of CACFP during this call. So before I go into that, just share a little bit about what Project Bread does. So we connect people and communities in Massachusetts to reliable sources of food while advocating for policies that make food more accessible so that no one goes hungry. The way I like to talk about this is that we very much focus on what we can do today. We have a number of different programs that help people immediately who are in crisis and need to be connected to food resources. But really, since we began over 50 years ago, there's also been an attention to what can we do long-term and permanently to make sure that the systems that are causing people to be food insecure can be changed. And that's where the team I'm part of, the policy team, really focuses. We certainly try to make policy changes that have that more immediate, maybe small picture effect, but then also really look at the big picture. And Amy already mentioned our School Meals for All campaign. So we've done a lot of programmatic work trying to increase participation in school meals. We knew the big barriers to school meals really were the cost and the stigma, the emotional barriers towards school meals, and then to some lesser extent, the barriers of the paperwork. So we really wanted to see what big, bold solution we could do, and we knew that Universal was working in a lot of districts. A lot of districts were doing something called the community eligibility provision, so we wanted to expand that to the entire state by making those National School Lunch Program and National School Breakfast Program meals free. So that's just one example. We've done a lot of work in the past, both on the state and federal level, advocating for changes in a number of the nutrition programs. So brief mention of some of the work that we do. As I mentioned, we do work closely on school meals. We have, for a number of years, employed chefs, and they've done a number of different things. That program's constantly evolving. At one point, we did have one of our chefs working at a Head Start program, so there's a little bit more overlap with the early childhood space. And more regularly and currently, they work with schools to work with our nutrition staff to improve the quality of school meals while really working within the limits of a national school lunch program. Because we know we could improve school meals in a number of ways, especially if you just put more money into the program, but that's not necessarily sustainable. So we work within the current limitations. And I already mentioned our child nutrition program that works to increase participation in school breakfast and summer meals. The large effort around summer meals, we've rebranded the Summer Food Service Program, all these great government acronyms and names. We rebranded it here in Massachusetts as Summer Eats, and our team works on starting new sites, working with new sponsors of that program, but also have done really great work branding that program and making people feel more comfortable. As a policy person, part of me does want people to know that this is coming from a government source, but at the same time, we know there's sometimes stigma and barriers if people think that it's a government program. So Summer Eats is a really great opportunity to say, just come, there's food in your neighborhood, and you can get the food. If people recognize that's a federal program, great. If they don't, and that makes it easier for them to participate, also really, really great. So whatever works to make sure people get that great resource. SNAP, so that's the Supplemental Nutrition Assistance Program, the largest anti-hunger program. So we do a lot of work on that because we know just the great impact it has on families and households across the state. And our first point of contact for most people is our food source hotline. So that's a toll-free hotline, and I can share that resource with Amy and the team at Strategies to share with all of you. If you have any families that you're working with that you believe are food insecure, and really probably just good to advertise to everyone just to make sure that we're not stigmatizing anyone. The hotline's a resource that anybody can call it at any point to get connected to things that are happening in their community. So it might be a food pantry, a community meal program, something of that nature. And then they're licensed with the state to be able to start a SNAP application. So we can really get them that immediate assistance and then the long-term assistance until they're able to move away from crisis and more stable footing. And our newest program is our healthcare partnerships, started during COVID. It's a program that's funded under Medicaid through something called an 1115 waiver. A lot of fancy government numbers there, but really what that is that we're working with people who receive Mass Health or are part of that Mass Health program, have a diet-related health diagnosis, and also are food insecure. And so we help them with grocery store gift cards, nutrition counseling, nutrition classes. In some cases, we found that some of these households don't have a proper refrigerator or don't have a microwave or don't have the utensils they need to be able to prepare healthy meals. So we've also been able to purchase those things for those households to make sure that they really can make the most of their benefits and that gift card and really prepare the healthy meals they need. That we all need, but also specifically because they have a particular health diagnosis and it would help improve their health status. So happy to answer any questions about all of that, but I'll move into the main topic of today, but the Child Adult Care Food Program. So just big picture starting off, it's a nationwide program. It was established in the 1960s. The National School Lunch Program was started in the 40s, but the 60s and early 70s was really a big time of expansion for meal programs. The school breakfast program became official in the 70s. The summer food service program was piloted and launched at this time. And there was a number of programs that came together to form CACFP. And so you'll see in this slide here, it's a really unusual program because it covers so much ground under that one big umbrella. It's really many programs within one. So it covers child care centers, the work all of you are doing, also family home child care centers. But also in some schools, they do use CACFP. It's really a choice of the school, whether they use the National School Lunch Program, CACFP for pre-K. There's also after school programs. So the after school programs, usually for things like the Y or Boys and Girls Club, or for a number of schools also use CACFP to be able to provide snack and supper. And then you may be wondering about the adult portion of that acronym CACFP. There's also the program also provides to older adults and adults with disabilities who are enrolled in care facilities. So usually like a adult daycare program for somebody who needs additional assistance during the day. Those programs can often enroll in CACFP and provide meals to those individuals. Like most of the federal nutrition programs, aside from SNAP, it has a meal pattern and nutrition components, meaning that there's research and best practices established for what needs to be served in order to receive reimbursement under CACFP. And that's certainly could be a point of frustration, but it also does ensure that CACFP, like school meals, has to hit a certain level of nutrition and provide quality meals to the participants. So there's certainly a lot of research around CACFP, like any of the nutrition programs. It helps make childcare more affordable. So by having those meals, that lowers the cost for you, and also then can lower costs for families who are paying for the program. reduces household food insecurity. You know, anytime that we're able to alleviate that burden with school meals, we talk about being able to provide up to half of a daily calorie through breakfast and lunch. So it's similar with CACFP. Um, we also have noticed because of that meal pattern and the encouragement through a program, that you do see increased consumption of certain types of foods like milk and vegetables. That may or may not be the case otherwise if a program wasn't there. And also, CACFP is uniquely positioned. You know, we have school meals that really kick in for most kids at 5 or 6 years old, but with WIC and CACFP, we have an early opportunity to expose children and families to a nutritious diet. And there's some great research about how that early foundation can really have lasting health impacts and changes habits for future consumption. With the National School Lunch Program as an example, kids make better snack choices in the afternoon at home. So this is an even earlier opportunity to really create that foundation of what's nutritious and and what's considered a healthy diet. So a little bit about the background of how this all works. So as I mentioned, it's a federal program. So USDA, the U.S. Department of Agriculture, provides the funding to states for administration and for reimbursement of programs. They also set the guidelines and regulations. So you know, if anything that we're finding challenging or frustrating, for better or for worse, a lot of that comes from a federal level. So we do need to figure out how we influence those policies to change. That's where most of the guidelines come from. In our state, and this may vary state by state, that funding and the rules flow into DESE, the Department of Elementary and Secondary Education. So they administer the program, they enforce those rules for USDA, and they also distribute the funding. They take the information about how many meals have been served and make sure that each sponsor gets the funding that's needed for those meals. They also do the monitoring of those regulations and ensure to make sure that everybody knows what they need to do. They provide the training for CACFP in particular. Depending on what kind of childcare program that's operated, you may then also work with a sponsoring organization. So there's 16 of those in Massachusetts. 4 of them are statewide, so you may recognize these names of Yours for Children, Inc., Child Development, Health and Nutrition, Clarendon Early Education Services, and Provider Resources. So those are statewide providers, but there's also a number of smaller regional, local sponsors. In this summer program, what I'm more familiar with and what we'll have to make sure that we have accurate, the sponsors really are the ones who are doing a lot of the paperwork and a lot of the administrative work behind the scenes to support the individual sites or centers. And so for the ones really kind of in between DESE and your center. So I'm sure if your operating center, there's still a level of paperwork and logistics that you have to do. But the idea is when the sponsor is then processing and monitoring some of that and providing that information to help kind of facilitate the program. You'll notice that the independent centers do kind of have more of a direct connection with DESE as opposed to the family daycare and other centers.
So Leon, I guess where we are right now, if people are participants of this, of CACFP, either use the raise hand function or put your program in chat. It would just be great to get a sense of folks who are already participating. And then Leon, if you could change it to family childcare and not family daycare
Absolutely.
on the side, that would be great. And I see Kathy Treglia has her hand up. You're acknowledging that you are a participant. Okay,
You
great.
told us to raise our
You
hands.
did it very quickly. I was like, is she reading my mind? Okay. So that's great. It's just I think it's great to get a sense of kind of on the call who participates. So we see Ellis. Thank you. Okay, back to you, Leo.
Absolutely. And then I'll just point out on the slide here that EEC is not actually connected to CACFP directly. The funding, the regulations, all of that is actually for DESE at our state. But as you all know much better than me, the role of EEC in your programs. And so we're certainly interested in making sure that we're providing the highest quality of education and care. And so they're very interested in promoting CACFP, but they actually have no connection to the operation of a program. as it stands. So these are some of the topics we're hoping to get to in the listening sessions we're having tomorrow and next week. So you can see here, we're certainly interested in what is working, just kind of get a good bearing of what's the positives, what can we kind of share around as best practices. Then of course also want to know what's not working, what can we try to adjust under current rules, and what rules do we need to change. The process for applying to for families and for centers to apply to be part of a program, a process for reimbursement. We know that sometimes waiting around for that funding can be challenging. So what is the process? What are the pain points there? The training around the program, the eligibility for children. There's a lot of complexity there, and just making sure that we're streamlining that process. Attendance and participation in meals, and what resources are useful for families. And I can bring that slide back up in a moment if it's useful. But wanted to get to this slide just so you had the information. And I know Strategies has been sending this out and can send out the links following this, but you also have QR codes if that's useful for you right now to get information about these sessions. But we're having the session tomorrow for group and school age programs, and then for family childcare programs, we're having that next Monday in the evening. Great. So that's actually the end of my slides. Again, we have these listening sessions. Really hope you can make it. But times don't work. We're very much, as I mentioned, in a learning phase here at Project Bread, and want to know more about CACFP and how we can use the information and knowledge we've gained from other federal nutrition programs to support the work you're all doing. So if you can't make it to these programs, I'll put my email in the chat. I'm always happy to learn and hear more, and try to figure out what we can do to support all of you. In addition to this, the work we're doing with Strategies and EEC at these listening sessions, Project Bread is also engaged in what we're calling a state plan process with a number of other organizations to figure out kind of the next several years of what we should be doing to address hunger in our state. And CACFP certainly must be part of that. So I really encourage anybody who has anything that they would like to share, please feel free to reach out. And also please, if you can, attend those listening sessions.
Thanks so much. So if you want to, so we have the slides, so we'll post them in the 9:30 call follow-up. I know Marissa added the RSVP for the 2 sessions, one tomorrow, one Monday. And there was a question in chat, but if anybody else wants to come live and ask a question, we can start there. Lauren?
Thank you. Hi, nice to see you again.
Likewise.
So I have like a comment / question, and I'm so disappointed I can't attend tomorrow, but so before being in early childhood education, I was at Boys and Girls Clubs in Boston, Boys and Girls Clubs of Boston, which participates in CACFP, but doesn't have the same process to participate. First of all of the kids that attend are automatically reimbursed at the highest rate, and their families don't fill out the forms because of Boston Public Schools. Well, now everyone's universal school lunch. It didn't used to be that way, which is so cool. But somehow it's just a much easier process for them. The parents don't have to fill out anything, which we all know is so cumbersome. And it doesn't, like, all kids are reimbursed at the same rate, regardless of what's happening at home. And so to me, that's like the promised land of where to get to. And I don't know what mechanism in life exists that makes it so much easier for them. And they're not licensed like by early education and care, like our centers and family childcare are. But to me, that's like worth digging into, because somehow that mechanism exists for them and it makes it easier on their families, and they get to get reimbursed at the highest rate. And so I would love it to be that easy for early ed and care. But I don't know what that is that makes it so.
Lauren, are you describing for a program, was it the after school meals?
Yeah, and summer meals, because they're open
Mhm.
camp, and it would be same thing. So I think they've served breakfast, lunch, and a snack at camp.
Yeah, so for after school and for summer, there's something called area eligibility. So like you were describing, it could be there's this whole thing with census tracts and like neighborhoods that I'm not going to bore everyone with, but if you want to get into the weeds with that, I'm happy to, because I did a lot of work with that. But depending on how many children in an area are free and reduced eligible during the school year, they could get after school and summer meals without the application process. It's just open, and that eliminates all that burden. And I absolutely hear you. You know, with schools, we had the community eligibility provision, which again, Boston's a good example. If you had a high enough number of students who were eligible, there was still a little bit of paperwork for the schools, but it was certainly greatly diminished. You didn't have to have families filling out any paperwork, so that as well is an ideal. So I think a lot of those rules are unfortunate on the federal level, but if we can figure out how to maximize those, and there is certainly some interest during the current administration with USDA to try to be creative. So I don't at the moment know exactly which lever and which way we could expand that, but I think that's worth exploring, because I think just like our lesson with school meals, we know that the less paperwork, the more time that means that, well, it's just easier for families, but also more time for your programs to do everything else you need to do. And specifically in the nutrition space, you know, that may open up more time and energy to do even more with the meals, which is all really exciting. So I hear you, and I think the more we can think and explore that, I think it would be really fantastic.
And also money, because keep in mind, like, for example, many of us feed our families, right? And whether or not they fill out their form correctly, their kid is going to get fed. So they're not necessarily like on the hook for filling it out the way it should be for us to get full reimbursement, because regardless, their kid is taken care of.
Yeah, absolutely.
Kathy Triley, did you have a question or comment?
Well, it was the same as Lauren's. I've been pushing this agenda for a while. Is, you know, it's the same community, the same children, the same families. And why is that benefit not extended to early education and care? I don't understand why they can't also get the free meals that the public schools are getting.
Absolutely.
I think that's exactly the question that has been driving Project Bread and us. Hello, Marissa, if you want to add anything. I also think this idea of like what happens where, who makes what decision is so important. So even untangling that to know like whose regulation is it and where does our advocacy need to be, I think is something that is really important part of this process. So we're grateful to have the expertise of the folks at Project Bread combined with the expertise of people who are doing this work every day to hopefully think about what that looks like going forward. Marissa, did you want to add anything?
Yeah, I think that was a great point, Kathy. And like Amy said, that is really kind of what's driving the work at Project Bread and Strategies right now. So I guess I would just put one more plug in for the listening sessions. If you all can help us spread the word about that. And we'd love to really get as much, you know, concrete examples, specific scenarios, things that we can kind of incorporate into next steps when we think about advocacy from you all. So I just would encourage you all to attend the listening session or to share that with your networks as well. And then the other thing, I saw a question in the chat about some 9:30 call like recordings. Where are we going to post these slides that Ron was sharing today? So we do have a 9:30 call follow-up materials folder, and that's where you can find slides, links to attachments, the chats, pieces like that. And then we also post the recordings on YouTube. And so thank you for flagging that, Lisa. We'll add those to the folder there too, just so you can see that. But we don't, as Amy said, we don't record most calls, but the ones we do, like this one, we'll post. So you'll be able to share that as well.
Great. We also posted, we added a new folder over the weekend to post testimony and talking points and the 9:30 call follow-up folder. So that's where we also post, like I just posted what I shared at public comment at the EEC board meeting last week. So we'll make sure that those continue to be available for folks. Thank you so much for joining us, Liron, and we're excited for the listening sessions. I think maybe post listening session, we can come back, maybe we can share kind of what happened during those sessions to the 9:30 callers. And if there are any kind of big topics that people, you know, you heard some of the thoughts this morning, but you know, keep this conversation going. The listening sessions are kind of the first step of this as we think about next steps. Any final comments?
You know, there was one question in chat that I just want to highlight about if Project Bread has anything to do with the reporting process. So I want to stress that we get to be in a very lucky position of promoting and supporting programs through things like our child nutrition outreach program. But we are not, like, we're contracted by the state for that work, but we are not in enforcement. We're not in the reporting. Right. So you could always feel safe to come to Project Bread and talk about what's not working in these programs. Actually, our programs in some ways are siloed. So our policy team, we don't engage our teams in doing that lobbying because we know what they have that contract, but we don't have a contract on the policy team. So we will do whatever we can to help make these programs better. So definitely feel free to be honest in the listening session. Feel free to be honest if you email me. It's really useful information for us to know to be able to advocate alongside all of you.
Thank you. That's such an important point. So we appreciate that. Okay, well, thanks so much for joining us this morning. Tomorrow, we're going to have on David Shapiro, who is the somewhat new CEO of the YMCA of Greater Boston, to hear a little bit more about David, his work before, and kind of what he's planning to do at the Y. So thanks so much for joining us, and we will see you tomorrow. Have a great day.